When preparing the patient with scars for massage treatment, it is important that the tissue be evaluated visually and with palpation. The following scar characteristics should be evaluated: pliability of the scar and the surrounding tissue, and the height, thickness, and texture of the scar. Scar vascularity and pigmentation should be observed. The response of the scar to limb and body movement may be evaluated to determine any area of scar restriction. In addition, the patient should be asked about their experience of pain, itch, or sensitivity in the scars. Massage techniques may be used to release adherent tissue, increase scar pliability, improve range of motion, and reduce pain, itch, or hypersensitivity. It is recommended that the following massage techniques be performed with the surrounding joint on maximal stretch, apply directly to the scar and/or to the surrounding healthy tissue, used in conjunction with positional devices when it is found to be beneficial, and to combine these techniques when it is appropriate. If you are using a lubricant, it should not contain perfumes, dyes, or alcohol. All of these techniques may be performed with appropriate levels of pressure, either light, which is gentle touch of the skin and no compression, moderate, which is compression of the tissue to half of the available space, and deep, which is compression to maximal available depth. The first technique is zigzag mobility. Place 2 thumbs on either sides of the scar. Depress enough to anchor the tissue and mobilize the scar transversely in opposite directions. Variations in pressure may be used. Perform with or without lubrication. The second technique, zigzag with friction. Place 2 thumbs on either side of the scar. Depress the tissue using the desired pressure. Move thumbs transversely across the surface of the scar in opposite directions. For larger areas, the fingers or palm of the hand may be used. Variations in pressure may be applied with this technique. Perform with or without lubrication. The third technique, pinch and roll. Pinch the scar between your thumb and fingers. Gently lift and walk fingers forward across the tissue, rolling the scar or the skin without releasing it. The thumb works as a support to the lifted tissue, pushing the tissue forward as the fingers release and grip new tissue. Perform without lubrication. However, lubrication may be used to reduce friction when performing the technique and allowing patient comfort. Technique number 4, pinch and zigzag. Pinch the scar between your thumb and fingers and gently lift. Mobilize the tissue transversely in opposite directions while maintaining the pinched lift. Perform this technique without lubrication. Technique number 5, pinch and traction. Pinch the scar between your thumb and fingers and gently lift. Traction the scar by moving the hands away from one another, creating tension in the scar. Perform without lubrication. Lubrication may be used for patient comfort, however. Technique number 6, circular mobility. Place fingers over the scar area and depress the tissue enough to anchor. Mobilize the scar in a circular direction. Variations in pressure may be used. For smaller scars, use thumbs, and for larger scars, use the palm of your hands. Perform with or without lubrication. Technique number 7, circular friction. Place your fingers over the scar area and depress using desired pressure. Move your fingers in a circular direction, sliding them over the surface of the scar. Variations in pressure may be used for this technique. Circle size may be small for isolated areas or large for greater surface areas. For smaller scars, use the thumbs, and for larger scars, use the palm of your hands. Perform with lubrication. Technique number 8, deep transverse friction. Use the thumbs or fingers to depress the scar with deep pressure, and slide the fingers perpendicular across the surface of the scar, passing over the borders. Perform with lubrication. Technique number 9, stretch massage. Place fingers or hands in the center of the scar, and using moderate pressure to anchor the tissue, mobilize it outward with a continuous force until the scar is under traction. Hold momentarily, then continue to slide your hands outward across the surface of the scar or skin. Perform with lubrication. A variation in this stretch massage technique is using one hand to anchor part of the scar. With the other hand, apply a moderate amount of pressure and mobilize the tissue until the scar is under traction. Hold momentarily and then continue to slide and mobilize the hand across the surface of the scar. Perform with lubrication. Technique number 10, torsional massage. Apply both hands with a cylindrical grip on the limb. Maintaining grip, slide hands in opposite directions across the surface of the scar, rotating the tissue cylindrically back and forth on the extremity. Perform without lubrication.